I've noticed from your website that you've secured a government-funded audit for ovarian cancer. Could you tell us a bit more about what this is and what it will involve?
Yes, that's right. We have secured government funding for an audit into ovarian cancer. This has come about as a result of a significant piece of work Target Ovarian Cancer has led on and done in collaboration with some other charities and national bodies, which was to carry out a pilot audit. And this was really to provide an evidence base that by carrying out this type of work, we can find out more about ovarian cancer and the diverse approaches to management or outcomes across the United Kingdom, well, in this case, England, where the study was carried out, and justify this kind of expenditure because it's a huge investment into that kind of study. And we are really pleased to say that as a result of that investment in that work, we have been able to evidence that an audit is necessary, and now we have secured this government funding for it.
That's a great achievement for Target Ovarian Cancer and good news for women, I imagine. Now, niraparib was recently approved for recurrent ovarian cancer. Can you tell us what the impact of this is likely to be and why it's important?
So niraparib is the first ovarian cancer treatment to move from the Cancer Drugs Fund into routine commissioning. So really what this means for us and our community and those healthcare professionals that are treating women with ovarian cancer is that the future of niraparib as a treatment for recurrent ovarian cancer is now certain. While it's on the Cancer Drugs Fund and while it's being reviewed, there's a huge amount of uncertainty. So niraparib is a drug from a class called PARP inhibitors. And this is a new generation of drugs that we refer to as maintenance treatments. So what that means is the patient receives this drug once their chemotherapy has completed. And the idea is that that drug will prolong the time between cancer recurrence and therefore the time between chemotherapy treatments for recurrence, which gives the potential for, well, just on a normal day-to-day life basis, it gives better quality of life because people can move on with their lives. But from a treatment perspective, it probably prolongs the number of times that we can treat the same patient with chemotherapy.
And my final question, what can healthcare practitioners do to help? And I'm thinking here of frontline people like GPs, practice nurses, community pharmacists, and so on.
I think the absolute first thing that they can do is make sure that their knowledge is absolutely up to date. Ensure that they're not carrying with them any outdated teachings that they may have received during their training, because we have moved on in terms of knowledge. As I mentioned earlier, Target Ovarian Cancer has a dedicated page for GPs, which has links to online e-learning modules, it has fact sheets, and it has short booklets. And all of this is really designed to support GPs and primary care professionals to update their knowledge and have the best knowledge of best practice so that they can manage their patient appropriately when they present with symptoms of ovarian cancer. I mean, we know ovarian cancer diagnosis is never straightforward. It's extremely challenging, but this is the first step in supporting an early diagnosis, is to get that baseline knowledge. If people were looking to take it further, they could consider doing an audit in their practice, maybe looking back to see if they've had any ovarian cancer cases diagnosed. If they have, how will they manage? What are the learning points from that experience, both from the practice and the patient perspective? Can often be a really good learning opportunity to look at a case that has actually happened in your practice. So I think those are the two main things that I would suggest in terms of healthcare professionals and expediting ovarian cancer diagnosis.
Dr. Tate, thank you very much for giving us an up-to-date picture of ovarian cancer and the work of Target Ovarian Cancer. For more information about Dr. Tate's work and the work of Target Ovarian Cancer, please visit our website using the link in the description, and be sure to sign up for more videos, news and journals. For updates straight to your inbox, please follow the link below. And as always, thanks for watching.